All right, so here you can see a shaved biopsy, and it looks like there's a basaloid neoplasm within the dermis. You might kind of see from this power that it looks to be retracting in a little bit. So just initial instinct may be to think somewhat of a basal cell carcinoma. But if you go in on higher power, you'll notice that there's not really that traditional peripheral palisading that you normally see in a basal cell. And you'll also notice that these cells are pretty small and round. There's some smaller cells with some compact hyperchromatic nuclei, and then some larger cells with maybe a little bit more open chromatin and vesicular chromatin with some pale cytoplasm. So two cell populations here, and they're kind of arranging in almost like a ductal architecture. So when you see this type of large basaloid tumor, some people call them big blue balls in the dermis. You can definitely think about a spiradenoma here. And all of the histologic features that I've described fit for a spiradenoma. This is often associated with Brooke-Spiegler Syndrome. So that's a high yield question and association. Oftentimes in spiradenomas, you'll find these eosinophilic collections of basement membrane material or type 4 collagen that's just kind of collecting randomly in these eosinophilic droplets. So that's also a nice feature to help you know that you're dealing with a spiradenoma. This is just another example of a spiradenoma. You can see again, the staining here is a little bit more blue, but you can tell that there's some darker, more compact hyperchromatic nuclei, some slightly larger nuclei with more vesicular chromatin. So those are those two cell populations. And you can see the eosinophilic droplets that I mentioned in the last case as well in this case. Again, it forms a really large basophilic tumor in the dermis, all consistent with an eccrine spiradenoma. In addition to being associated with Brooke-Spiegler syndrome, you should also remember that these tumors are often painful clinically as well. And a very much related tumor to the spiradenoma is the cylindroma. So the cylindroma, again, often seen in Brooke-Spiegler syndrome, these two tumors share the CYLD gene mutation. So they're kind of derived from the same pathophysiologic mechanism. But you can see that the cylindroma fits together really nicely. Some people liken this to puzzle pieces fitting together. You have the same two kind of cell populations that are in a spiradenoma, the dark compact cell population, the little bit larger, more pale nuclei population, and then it's surrounded by that nice thick eosinophilic wall, again, type 4 collagen. But it just has a different morphology than a spiradenoma. So this is a cylindroma, although they are essentially derived from the same gene mutation in most cases, and that's why you can often see in the same specimen both tumors presenting. So here over to the bottom left of the biopsy, you have something that looks a lot more like a spiradenoma here. So you have a spiradenoma in the same section as a cylindroma. And sometimes these are actually blending together. And so some people may sign them out as like a spiradenocylindroma. So again, if you find a lot of these in one patient, you're definitely going to want to consider Brooke-Spiegler syndrome, which is often associated with a basal cell carcinoma development too. And so you may be needing to biopsy these every time they show up to make sure you're not dealing with a basal cell carcinoma. All right, well, that's all I have for this entity here.